Okay, we'll be demonstrating lumbar traction today. We have a patient that has had chronic low back pain that's began to radiate through the buttocks. An indication for spinal traction and lumbar traction would be peripheralization of those symptoms, as well as reduction of symptoms with specific exercises like Jake has when he flexes forward or sits down. Contraindications would be pregnancy, spinal fusions of any kind, and osteoporosis, things of that nature. Okay, Jake, so you said that you've kind of had reduction of your symptoms and the pain that you've been feeling when you kind of sit down and let your back take breaks, right?
Yeah, it's moving forward. So.
Yeah, so we want to kind of stretch that spine out a little bit and see if that will help your symptoms go away. So that's what we're using this traction machine for. Is it okay if I set you up on that? Okay, so I'm just going to find your iliac crest here. And then we'll wrap this tight over it. Actually, have you slide down just a little. There you go. Crest. Thank you. Is that tight? Yep. Nice and snug, okay. And then this one will wrap just below your rib cage here. I want that to be snug too, but not too tight for you. Oops, we'll actually come this way first. All right?
Yep.
Okay. Okay, now clip this. Now with this, as it's going, it'll progressively pull you a little bit more and it'll ramp up and down.
Okay.
Like I said before, we should kind of experience less pain in your back while we're doing this. It should kind of go away. Hopefully it'll come out of your buttock area as well. So if you notice that it's doing the opposite or experience pain or discomfort in your spine, please let me know.
Okay.
I'll also give you a little button to push to stop it if you need to.
Okay.
Finish sitting this up here. Okay. So here's that button. If you push that, it'll just turn off the machine.
Okay.
Just clip this right on this middle ring. All right. Comfortable there, Jake? Okay, now we'll set the parameters here. So we'll be doing traction, the lumbar spine. We're going to do a posterior protocol because it's a facet issue. Do manual. We'll make this 5 regressive steps here to make it intermittent. We'll do 45 seconds on and 15 seconds off. And then we want half of the maximum traction force for the minimum traction force. So done. Now we want to slowly work up to about half of his body weight. He weighs around 180 pounds, so we'll work up between 85 and 90 pounds of traction. I'm just going to work up slowly, Jake. You let me know when you start feeling that pull, okay?
Okay. Yeah, I can start feeling it.
Okay. Comfortable?
Yeah.
Good. Yeah, and this table will start spreading a little bit, so it'll just keep
Yeah.
tugging on you a little.
Start feeling it slide.
Okay. Just gonna take it up to 85, and then we'll see how that goes there. We'll let the table stretch out all the way. And if that still feels good, then I'll hit start, and we'll go for about 15 minutes here.
Okay.
Dr. Clausen, what do you call a pile of kittens? A meowton. You're welcome. Hopefully you saw that. Okay, wait a little bit longer.
Yeah, that feels nice.
It just takes a little bit to get fully stretched out. Okay, we're there. Now we'll hit start, let it go for about 30 seconds for the sake of time. And then we'll end the treatment for you and make sure that nothing's happened with your skin or anything like that. You still feel okay? Comfortable?
Yeah.
Good. Are you starting to feel that come out of your buttock area?
Yeah, it feels a lot better. Perfect.
Just what we wanted. Okay, so now we'll stop the treatment. And that table will slowly come back in. Perfect. Okay, we'll unhook you here. Take that from you. Okay, is it alright if you just lift your shirt for a second? I'll just inspect this area for you. Okay. Skin all looks good. Okay. Any questions or concerns?
Nope. Thank you.
Treatment done.